I'm Lucas. I'm CEO of Nightly, and thanks for a great introduction. Really good. So I'll quickly run you through what Nightly is, just so you know what we are about, what we're doing, and then the objective essentially of this presentation is to bring you a little closer into how digital health works, how it works from kind of behind the scenes, right? Because it's so much different than a normal startup. And just to tell you, 4 years ago I was on this stage. Well, not this one. There was another one there. I was a VC back then. Then I founded Nightly. Since I founded Nightly, I've done basic clinical study courses. I've done basic introduction to psychology and psychiatry at MIT and cognitive science at Stanford, and also studied at Singularity University back in 2015. So this is a little bit about me. I'm technically a business person with some understanding of science, and I'll quickly walk you through on what we do in Nightly. So firstly, kind of starting as every startup with a problem. So pretty much a third of the population has trouble with sleep, and this is what we are addressing. We are addressing sleeplessness. We are addressing the problems related with that. And if you look at it, it was calculated in the US that sleeplessness accounts for 8% of productivity loss. And this is a major, major issue that we are trying to address. And I'm sure that you're here at Infoshare and you won't have a couple of nights where you won't sleep too much. So this is fine. And kind of looking into how large the problem is in terms of numeric values, if you look at the slide, this is essentially so much bigger than anything else. And it's surprising. When you first look at the data, I was like, okay, this is weird, right? Because technically, cancer should be larger. And yet, sleeplessness is like the major cost factor in the US. And at the moment, if we look at sleeplessness, the two major things that are done to help with it, it's on one hand, it's pharmacology, which is not very healthy and has lots of side effects. And on the other hand, it's therapy. Interestingly, CBTI therapy, when it comes to sleep, costs about $3,000 in the US for the whole treatment. And this is Nightly. I do encourage you to give it a shot and give it a try, and I'd love your feedback. We've launched it a couple of months back. We have close to 1,000 paying users at the moment. And we are pretty much available by everywhere. 80% of our users are based in the US. And it's essentially designed to be simple. So all you need to do is essentially download it. Before you fall asleep, you launch it, select the theme. The theme helps you fall asleep. And then as you sleep, as you have your phone on the mattress, the sound stimulation technology that we designed help you sleep throughout the night a lot better. And most of our users typically have either insomnia or frequent nightmares, and this indeed helps them a lot. And you can see that by the feedback we get. So we have 4.6 stars on iOS, and people essentially love it. This is one of the data sets we pulled. So in essence, this is based on 800 users who had sleep troubles. And as you can see, over time, they get to sleep a lot better. So we see improvement even on the first night. And this is cleanly, pretty much just user data. We also have clinical data, which I can't show yet. We're in the middle of getting it published. And this is essentially what I'll be talking about for most of the time now. But yeah, speaking of digital health, one of the tricks, because we've been running it for 4 years, one of the things we see that in order to succeed in digital health, you have to understand that this is both, it has two things. On one end, it's digital, right? So you're building a product which is just an app, just like any other company, right? And on the other hand, you have the health factor, right? So you have to be very clinical about your approach. You have to have the data right. You have to have the whole procedure right. And this is crucial. Because if you lean too much in one direction or the other, you will essentially fail. Because if you build a product which is nice, then sure, you might monetize early on. But then you'll run into a problem that this is essentially, well, a bit of a scam, right? If you do too much research, then there's a chance that your app will not work. And people will not like it and they won't use it, right? Because this is super important. But going more into the digital side of things, into the product side of things, and what's important. So firstly, when you build an app just like us, the first thing is that you are facing a bit of a competition from physical side, right? Because at the moment, what would you trust more, an app or a pill? Most likely pill, right? So this is one of the things you have to fight with in a way, and you have to convince people that an app can also help them, right? This is not just a pill, this is not some sort of wearable, but an app. And this is a challenge. Second thing, yeah, I'm actually managed to put Pornhub on the slides. So second thing, just think by yourself, what was the last app you've seen before falling asleep? Was probably either Facebook or Pornhub. Like literally, there's data for that. And this is something that we compete with, right? If you build an app which is designed to help people asleep, so we are not competing with anything else, we are competing with Facebook or Pornhub, which is interesting. Or games. And third thing, when you build a digital health product, essentially people want the app to be a therapist in a way. So they want to trust you, which means that the design and the UX side of things, I could probably talk about it for another hour or so, is so much different. Because something we found out that users are happy to answer more questions, users are happy to essentially talk with us. We often email our users asking, okay, how do you enjoy the app? Do you like it? What can we do to improve? And interestingly, we get a lot more feedback than I would get in any other app, right? Because essentially, we want to help people sleep better, right? And they want to interact with us because, in essence, we are helping them. So this is from, kind of perspective of running a company, it's pretty cool because you get to work with people, you get to solve their issue. And this is just to show you, kind of on our end, we've been working a lot on the retention end. And as you can see, we managed to pretty much double what's considered a standard in mobile in that area. And that's why it's so important, right? Because in essence, if you build something that works, and from a perspective of a product, it's still the same thing. And this is just the product changes, so how we improve it over time to make sure that users return to us, to make sure that they use it again. So yeah, it's super important over time. But yeah, going back into the health side of things, right? So firstly, when you build a digital health product, you have to deal with regulation. Because in essence, this is a regulated industry. I can't essentially use a word saying, oh, Nightly is an app which will treat your insomnia, because then the guys from FDA will come over and probably arrest me. So yeah, we can't do that. We have to be very aware of regulations that are there. We have to be very aware of how things are done. It's super regulated. It's actually, when you run a startup, it's difficult, right? Because when you run a normal company, you don't have to deal with that much. In our case, at every kind of corner, there is some sort of a barrier that we have to be mindful of. And obviously, over the time, one of our objectives is obviously going through FDA as a Class 2 device. We're actually in process of that, but it will take probably another year or two. Pretty complex in our case. And that's what I mentioned about claims and FDA. And another thing, as you're going through the whole procedure, you have to have a QMS or ISO certificate in the company. So that means that you're no longer a startup which can essentially decide, oh, guys, let's just switch something around. But you have to have every single thing you're doing documented. And this is, from a perspective of running a company, this is very painful because you suddenly you have to start being a little bit corporate just to have the paperwork showing that, yes, this is the change what you've done, this is why we've done it, and this is the whole procedure why it's being changed. So it's a bit of a challenge for a startup. And this is some essentially pictures, if you're interested, how our clinical studies look like. This is polysomnography, which is used in clinical trials of sleep. So this is essentially 36 electrodes which measure everything from EEG to EKG through limb movement, eye movement, and so on. And this is essentially raw data that we get. So this is all that essentially creates a simple app that you can download on the App Store, right? When it comes to clinical validation, this is like super important thing if you're considering building a digital health startup. So how does it look like, right? And how does it work? Because it's so much different than anything else. So just to give you an example, our study design was created about a year ago, and we just finished the study itself. And we can't change anything as we go, right? It's not like when you build a normal product, you can go like, okay, well, it doesn't work, let's just change it. In our case, you kind of commit yourself to it and you have to do it. I mean, obviously you can stop, but then you lose a lot of cash and a lot of time. And when it comes to time, study design typically takes a month or two. You have to be very, because it's something you can't really stop, you have to be very precise about it. You have to look into how other studies are done. You can't just decide, okay, we're going to take like 10 people, put them in a sleep lab, and we'll see what happens, right? Because that's the problem, for example, with statistics again, right? If it turns out that you have 2 people with certain thing, 2 people with other thing, and 2 other people who are healthy, then you run into a problem with statistics, right? So you end up with data which is essentially, from a scientific perspective, useless. So again, study design, super important, takes a long time, and it's very important to have essentially very smart people, like leaders in your area, write the study design or help you write it. So in our case, we have one of the best Polish sleep scientists working with us on that, and one of the best behavioral scientists in the world, who's a professor at the University of Nevada, who's helping us with that as well. He's published about 700 papers, so we have a pretty good help there. And then as you run it, you also have to hire external organizations which help you run the clinical trial itself. And obviously that's another thing, when you build a normal product, you kind of launch it and you watch it. When you do a randomized clinical study, you can't really be part of it. It has to be done independently to make sure that you are not influencing the results. And then obviously, as you build your study design, then you have to go through institutional review board. In our case, it took about 2 months. So you send the whole paperwork. It was, I think, 100 or 200 pages. And they look at it, they review it, and at some stage they decide, okay, this is fine. You can do the research, right? So it's another kind of thing that slows you down and you have to be mindful of, especially when you run a startup and you have to have in mind that this thing takes time, right? It's not like the typical founding cycle when you can raise enough cash for 6 months, 12 months and be fine. In this case, you have to have a bit of a budget to make sure you have enough for a year or so, or a year and a half. Then the next fun part is that because you can't be present during the research, you have to train nurses to essentially help users operate your app, right? And then the trick is, if you do it in a wrong way, if there is any bugs in the app, then you essentially lose time. And the cost of failure in clinical research is insane. So just to give you an idea, the research we've done, the cost of it was about $500,000 or so. If we, for example, lost like 3 days of research because we screwed something up, or the app crashed, or we trained the staff in a wrong way, then we would essentially lose about 100K. And this is something you can't get back. Sure, you can pay it again, but this is the data lost. So it's super difficult. It's so much different than running a normal sort of company. And then you have, obviously, everything you do is being monitored, right? So just to give you an example, there is a lot of paperwork involved. In our case, the budget for printing, and I don't mean like commercial printing, but like for paper and ink, that was about $2,500, and we essentially had like a room full of paperwork for the research, and it's all being reviewed by an independent monitor who's going through the stuff and says, okay, this has been done properly. And then obviously there's the whole write-up procedure and publishing procedure, right? Which again takes months and months and months, right? You submit the paper, you have to wait for a month. Then once it's submitted, then you have to wait for another months or years to have it published, right? So it's again not the typical stuff you do with a company when you just run some data, put it on the website, and you're fine. Here everything has to be reviewed, peer-reviewed, read, and then published. So it's very slow, and that's one of the challenges of running a digital health company. That on one end you build a startup which has to work fast, which has to generate revenues, which has to proceed in a very fast manner. On the other end, you deal with the clinical side of things, which are super difficult and super slow often. And interestingly, which is also a good thing for us, is that, for example, the regulations change and they're being easier and easier on startups, which is great because it allows us to be more flexible about things. And I just wanted to share you with some of the hacks, which I think are like super important in that space. And I think that's the major lessons we had so far. So when it comes to clinical research, you have to do something which is not natural from clinical perspective. So I would say you have to start small. With a study, it doesn't have to be, it's ideally if it's approved, but start with something small and then scale up. Because in essence, logic and typical clinical logic tells us to, just do a large study, and in this case, you have to do it in small steps. So you have some data to show to VCs and say, okay, this is, we have data from say 20 patients, and we want to scale it to 400, right? And you have to pray a little bit to have to be lucky with the data and with the trends and so on. So it's tricky, but I think that's the best way to do it. Because in reality, so for example, our next study, we will have to probably spend about 4 to 5 million on that, and it's very difficult to convince VCs to throw that amount of cash. This is like pretty much the most important thing. You have to build a great advisory board. Like literally, I don't think we will be able to do anything without the advisory board, especially in digital health, because a lot of people you will be working with, a lot of expert scientists, they have their jobs, and it's very difficult to pull them from them. Because if, for example, someone is a head of some unit in a hospital, then if he leaves and your startup fails within the 6 months, then it's very difficult for them to go back. So you have to manage somehow. So how we do it is that we have a couple of juniors, couple of mid-level people, and then we have a very, very awesome scientific advisory board that essentially oversees everything we do and helps us build it properly, and also brings a lot of interactions. So this is super, super important. And kind of from my perspective, you have to aim high. So the better the scientist, the better. I wouldn't limit yourself to just essentially Polish scientists or local scientists. We have a couple of scientists from US in our advisory board, and they're doing an excellent job. And this is I think this is most important thing that we do is you have to earn trust. And by earning trust, I mean earn trust both of users and earn trust of clinicians, and then earn trust of everyone you collaborate with. Because if you look at digital health, there is tons, literally tons of startups which are, I'm looking for a better word than scam, but this is very close to that. Promising, insane, impossible results. And you have to from the beginning, as you work on your product, and as you work with your advisors, and as you work with clinicians, you have to be very honest about it, because it helps in the long term. We've been doing it for 4 years, and right now, some clinicians would 2 years ago tell us, oh guys, we're not going to work with you because you're so young and you have absolutely no idea what you're doing. Now they're coming back to us and saying, okay, can you guys work with us, because it seems like you're doing a great job. And so yeah, this is super important, trust. And it's very, from a perspective of running a company, it's sometimes you're tempted to essentially just say, okay, let's just do a huge PR study and tell people, oh yes, it works. But yeah, in the end, trust sort of wins, and I think we have trust of our users. So cool, and that's that.
Yeah?
Yeah, cool.
I trust you've built a wonderful product. Thank you very much for sharing your journey with us. And now...